Hi, I'm Dr. Jeff Langmaid, and you're watching Research That Matters TV. Knees hurt? Well, you're not alone. Chronic knee pain is thought to affect up to 25% of adults and can significantly limit your mobility and quality of life. Your knee is a hinge joint that primarily moves back and forth through flexion and extension and allows a little bit of twisting and rotation. Each step you take places stress and strain on your knees, so it's no surprise that trauma, misalignment, and degenerative changes can all take their toll. While knee pain might not be entirely preventable, there are steps you can take to keep your knees as healthy as possible. At the top of that list is to watch your weight. For every pound you're overweight, your knee must absorb an extra 4 pounds of pressure when you walk, run, or climb stairs. In addition, the cartilage in your knee is designed to last a lifetime if you take care of it. Here are a few additional ways to keep your knees healthy and strong. Warm up before exercising. Stretching your quadriceps and hamstrings before and after you exercise is a smart way to reduce the chance of a flare-up of knee pain. Finding adequate foot support. Every step you take transfers force from the bottom of your foot to your knee. Therefore, your shoes should provide the support you need to keep your knees healthy for at least 10,000 steps each day. And finally, maintaining a full range of motion. Ensuring your low back and hips are moving freely is essential to overall knee health. The joints of your body should have a balance of strength and flexibility throughout their entire range of motion. Unfortunately, it's not common for people with back issues to find themselves struggling with knee pain after limping around for a few weeks. We encourage our patients to be proactive with their health. Use the strategies that we've talked about in this video to help reduce your chances of knee pain, and be sure to call the practice if you notice any pain or restricted motion. I'll see you next week for another episode of Research That Matters TV.